So hi bacha log, I had posted this image as a quiz question in my INICT preparation group, and I'm posting this on the Instagram also now. So what do these two images depict? These are two very important images that are given in the INICT exam. So you should be very clear with this. So what is the first image showing? So first image is showing a lot of cystic spaces in the brain. Along with that, there is a white larva inside it. Okay, so that white dot inside it is actually the larva. So that's a typical gross of cysticercus. So whenever you are seeing this gross appearance, remember, focus whenever you're seeing multiple cysts, small cysts, and along with that white larva is inside it. That's very typical of cysticercus. And a microscopy, what is it showing you as? So the microscopy is showing you the typical scolex below, and with that the curved body structure is shown. This is the cross section of the larva. So the answer to the first image on the right side, upper top right and the lower right, is basically cysticercus. Okay, so that's the answer for cysticercus for the image on the right side. Coming to the left side image, let's focus this image again. Okay, so the left side top image is basically the abscess which is there in the brain, and the radiology is basically showing you ring enhancing lesion. And what do you see in the microscopy? Look at this focus here. It's a pseudocyst basically, which contains Toxoplasma bradyzoites. So this Toxoplasma bradyzoites, there are multiple bradyzoites inside the cyst of Toxoplasma. So this is very characteristic of Toxoplasma. Everybody should be very clear about this. So these pseudocysts with brachiozoites basically indicates the chronic stage of Toxoplasma. The acute stage of Toxoplasma contains a lot of tachyzoids, which are little, spindle shaped organisms, and both of them are very purple colored structures which you can see in the brain. So active stage has dividing tachyzoids, whereas the chronic stage forms the pseudocyst with a lot of bradyzoites inside it. So remember this is a very typical image of your Toxoplasma. So remember these two forms, tachyzoids and bradyzoids, and do not confuse these. Okay, so these are the two very typical gross which comes in the brain. Please remember. So we have to know cysticercus and Toxoplasma, gross and microscopy both together. Bye guys.